Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center. Today is Tuesday, September 1st. Wow, it's September.
Yeah, summer's going.
That's why I have on my warm jacket here.
Yeah, cool,
okay,
nice.
Let's jump into the numbers for COVID. Capital Region, you can see the graph right there. We currently have 37 people in the hospitals of the 8 counties of the Capital Region being treated for COVID. And Fred, we were talking about this. The numbers are staying about the same. Occasionally we see some pop up in certain areas.
That's right, Dennis. So we talk every week with all the other hospitals. So last week we heard that there was a little increase in Schenectady County relative to Albany County. This week, perhaps there are a few more hospitalized patients in Albany County. But the total number for the region is really, I think, what's important, and that's relatively flat.
And that's one of the great values of that regional call every week is we can talk to each other and what they're seeing.
We get a good sense of what's going on.
Next graph is Albany Medical Center specific admissions and discharges, and you can see again a couple days there where we've had no activity of either admissions or discharges, including yesterday, which brings you to today's numbers. We currently have 14 in the hospital, 12 on the floor, 2 in the ICU, none currently on ventilators.
That's right, Dennis.
So that's the activity here in the house. It's Tuesday, so Fred, you normally update us on the travel advisory from the governor's office. I'm a little bit unhappy. I heard a state was added back on.
Yeah. So Montana and Alaska have both been added back on. So no fishing.
I can't get to
no
Montana.
Fishing in Montana, yeah.
Did anything come off?
Nothing came off.
Nothing came off.
Nothing came off.
Okay.
You know, when you look at the map, Dennis, the epidemic seems to be rising up into the Midwest. Some of the southern states and the western states have kind of damped down their rates, but you know, some of the Midwest states are growing.
And just to remind our workforce, if you are traveling to one of those states and you're coming back to the area on the weekend, we have the ability to come in, get checked. If you're symptomatic, we have a different door for asymptomatic, and we thank not only the practice, the faculty practice, but employee health service for really monitoring our workforce.
And it's important to do that.
Yes, they're doing a great job, as is our workforce for coming in and getting checked.
Tremendous.
A little bit more on COVID visitation. As you know, we're still under the executive order Governor Cuomo put out that limits visitations for people in the hospital to 4 hours in any given day, and I think one person at the bedside. Fred, you've been walking us through a process where we've been looking at that and trying to figure out a way in which we can codify that, what we learn from that, and update our visitation guidelines as allowed under the executive order.
That's right, Dennis. Really, Louis Philhauer and the nursing AVPs have been working on this for the last week or 10 days. And the idea is to try to give a little bit more clarity to either nurse leadership, the nurse manager, or a charge nurse in terms of what's permissible or what we should do, or even the bedside nurse if they're the one making the decision about visitation. So as you said, the executive order has some boundaries that we can't cross, but there are opportunities for compassionate exceptions, and we just wanted to clarify how that would work. So that's in the new visitation policy.
So if I'm a nurse manager, if I'm a physician, if I'm anybody in the workforce who wants to review that policy, where would I find it?
It's on the website, the internal intranet website. Very easy to find.
Very good. Very good. All right. Next, let's talk a little bit about flu. Now, today is September. We're starting to enter the fall. Let's talk about flu vaccine a little bit. Let's talk about historic or numbers of flu activity in the past, and then also let's talk about how we're prepared for that. So Fred, you and I both have already received our flu vaccine.
We got our shots on Friday.
And so they're here, they're available to start giving out to our workforce. We know that it's safe and we have enough on hand at this time.
We do.
And we've set an internal deadline as required to have it done by the first week in November.
That's right.
November 2nd, if
per
I'm not
our
mistaken.
policy.
Per our policy. So we're certainly encouraging members of our workforce to go ahead and get that vaccine, and Employee Health Services, the location. We're going to have a couple, I think, 24-hour flu clinics as well.
That's right. We're going to try to really make it available. In the past, a lot of our staff would get their vaccine at the picnic, which we'll talk about in a moment.
Right.
But that's not going to happen this year. So we've opened up we're going to be opening up these flu clinics.
Okay. Flu is one of those things where we look at the numbers on an annual basis, and there is a spread of cases both regionally and nationally as far as flu activity. we can all recall years where activity was higher than others. H1N1 back in 2009. I think most recently 2018 was another busy year.
That's right, 18, 19.
Yeah. Give us some perspective, Fred, on what those numbers in the past have looked like as far as flu activity.
So 2018 into 19 was a very busy flu year around the country. And there were about 800,000 people admitted with the flu during that epidemic.
Okay.
And about 60,000 people died from the flu.
Okay.
So that gives you some sense of what a bad flu season looks like.
And I recall that because here at Albany Medical Center, the hospital was very full with people, and we had to set up even alternate treatment sites
That's
for
right.
people who presented so we could care for everybody who presented. So thinking about that and thinking about how we might have another very busy flu season and also have to deal with COVID at the same time, I know you've put us on a path where if people look outside in the next couple of days, they might see something familiar.
So, Dennis, we're going to put the tent back up in the P building parking lot. So
Yes.
you'll recall we had that last spring, and we use it as a testing site for people with respiratory symptoms. So we're trying to be prepared as we enter respiratory season, whether it's the flu or just the common cold or parainfluenza or COVID. That'll be the site where we'll test people.
So this is going to be coordination, off the top of my head, emergency department, emergency management, epidemiology, facilities, of course,
yeah.
all these people
Yeah.
working together, drilling and being prepared for all different possible scenarios. And so credit to our workforce for being
Yes.
proactive and getting that out there. So if people see the tent, now they'll know why that's being put up again.
And hopefully, Dennis, we won't have to use it or
Right.
use it to any great extent, but it, I think, behooves us to be prepared.
All right, and we'll certainly update more about that in the next couple weeks. So speaking of tents, in the past we would have a tent put up for our employee celebration, the picnic.
Yeah.
This year, as we talked about last week, we're going to take that event and split it up into 3 different events, which will allow us to do this in a manner that's safe. And the first one is tomorrow. And there's a
right.
couple things I think we want to say about the picnic.
So tomorrow it's from 3 to 6. I think I'm handing out stuff
Yes.
from 4 to 5.
I think I'm there from 3 to 4.
Good, good. It's important that you remember to wear your mask when you come out, bring your ticket, and socially distant.
For sure.
Be socially distant as you're waiting in line.
For sure. And in addition to that, if tomorrow or any of the other days, the next 2 picnics, you can volunteer, please look for the messenger, reach out to either Bob Pastilli or Scott Heller, John DePaula, and we'll be happy to put you on that list to help.
Absolutely.
For
the
sure.
more people we have handing out the meals, the better.
Very good. Fred, 100 nurses in 100 days. Are we close to hitting our target?
Dennis, we've exceeded, and I say we euphemistically, it's not we. The recruitment team has exceeded their target. So we have 107 new nurses who've accepted offers after 7 weeks,
Yeah, it's
which
incredible.
is only half the amount of time we thought we'd have to devote to this. So as we've said previously, the target's now 150,
Right.
and I have every confidence that they're going to get there.
The recruitment teams, human resources, everybody working so hard on this. It's really great. So let's keep
it's
going.
tremendous, absolutely.
Finally, Fred, you mentioned personally that you had a new member of your family last week, so
Yes.
congratulations to
Thank
that.
you.
We have a new member of the Albany Med family today.
That's right. Capital Region Otolaryngology, head and neck cancer. So 3 surgeons,
Yep.
ENTs, who are both in Troy as well as at Stuyvesant, have an
Incredible.
office at Stuyvesant. Mike DeVita, John Kopp, and Michelle Yoon have joined us as of today. They also have a number of other important staff in their office that we look forward to working with us as well. So welcome to Albany Med.
For sure, welcome. A practice with an incredibly good reputation out there, great reputation, and so we welcome them
Fantastic.
to our family for sure. All right, that'll do it. Now, Fred, I'm not here Thursday, so who'll be sitting with you this week?
Dan Pausé.
Okay, very good. We look a lot alike, so that may confuse people.
I might make him sit there.
So we welcome Dr. Posey this week, and you can take the lead there, and I'll be back again next week. So I'll look forward to seeing you then, and Fred will be here on Thursday. We ask that you once again please take care of yourself, take care of each other, and we'll see you in a couple days.